The fat that could save your life and why everything you've heard about fat is wrong. What if I told you that fat, which you've been avoiding for years, might be the key to clearing your arteries and maybe even saving your life? After 25 years of working as a cardiologist and seeing patients with heart disease, I've learned something that goes against everything we thought we knew about how dietary fat affects heart health. If this information could change your life, please subscribe, like this article, and share it with someone you care about. Your heart will be grateful later. The fat I'm talking about isn't what you think it is. It's not the trans fats or the saturated fats in butter that have gotten a bad name. Omega-3 fatty acids, especially the long-chain ones, EPA eicosapentaenoic acid and DHA, docosahexaenoic acid, are a type of fat that most Americans really need more of. But here's the shocking part: even though there is a lot of scientific evidence that these fats can actually fix damage to arteries, lower inflammation, and stop heart attacks, the average American eats less than half of what is recommended. At the same time, we're eating 20 times more omega-6 fats that cause inflammation than our ancestors did 100 years ago. How we got here, the great fat deception. We've been living with one of the biggest nutritional myths in modern medicine for more than 50 years. The 7 countries study by researcher Ansel Keys, published in the 1960s, seemed to show a link between eating saturated fat and getting heart disease. Even though this study had a lot of problems and used data that wasn't representative, it started the low-fat movement that has shaped nutritional guidelines ever since. What happened? We swapped out healthy fats for processed carbs and sugar, which caused rates of obesity, diabetes, and, ironically, heart disease to go through the roof. People like the Inuit, on the other hand, eat a lot of fat from fish and marine mammals and have very low rates of heart disease. The Japanese have some of the longest lives and the fewest heart disease cases in the world. This is because they eat a lot of fish that is high in omega-3s. The proof was right in front of us, but we were looking the wrong way. The science behind omega-3s, how they really help your arteries. In order to understand how omega-3 fatty acids clear arteries, we need to look at atherosclerosis, which is the buildup of plaque in the walls of arteries that can cause heart attacks and strokes. The link to inflammation. A lot of people think that cholesterol is bad for your heart, but it's not. It is inflammation. Your arteries don't just build up cholesterol like dirt builds up in a pipe. Chronic inflammation, on the other hand, harms the walls of arteries, making them rough and allowing cholesterol and other substances to stick and build up. This is where omega-3s do their thing. EPA and DHA are strong anti-inflammatory chemicals that work at the cellular level to stop the inflammatory cascade that damages arteries. They do this in a number of ways. 1. Resolvin production. Omega-3s are turned into special pro-resolving mediators known as resolvins and protectins. These compounds don't just stop inflammation, they also help it go away, which helps the body get back to a healthy state. 2. Membrane integration. EPA and DHA get into the membranes of cells in your cardiovascular system, making them more flexible and less likely to get damaged by inflammation. This is especially important for the fragile endothelial cells that line your arteries. 3. Gene expression. Omega-3s literally turn off genes that cause inflammation and turn on genes that fight it. This happens because they interact with transcription factors like NF-κB and PPARG, the effect of plaque stabilization. Omega-3s not only stop new plaque from forming, but they can also stabilize plaque that's already there, making it less likely to break and cause a heart attack. A thin, fibrous cap over a lipid-rich core is what makes plaque unstable. When this cap breaks, it causes a blood clot to form that can completely block the artery. Studies show that taking omega-3 supplements makes the fibrous cap thicker and lowers the number of inflammatory cells in the plaque core. This changes plaque that is dangerous and unstable into formations that are more stable and less threatening, making arteries work better. Omega-3s not only reduce inflammation and stabilize plaque, but they also make your arteries work better. They improve endothelial function, which is the ability of your arterial walls to open and close correctly. This increased flexibility makes blood flow better and eases the pressure on the walls of arteries. EPA and DHA also make heart rate variability better, lower blood pressure, and lower the risk of dangerous arrhythmias. Some studies even suggest that omega-3s are better at stopping sudden cardiac death than heart attacks. This shows how strong they are at changing heart rhythm. The study that changed everything. There is more than just a few small studies or theories that support omega-3s for heart health. There's a lot of research behind it, with hundreds of thousands of people taking part. The DART study, the first big step forward. The Diet and Reinfarction Trial DART, which came out in 1989, was one of the first big studies to show that omega-3s are good for your heart. Researchers looked at more than 2,000 men who had just had heart attacks and randomly put them into groups that followed different diets. The results were amazing. Men who were told to eat fatty fish at least twice a week had a 29% lower risk of death over 2 years than men who were not given any dietary advice. Even though there were no big changes in cholesterol levels, blood pressure, or body weight, this benefit for survival was still seen. The GISSI-Prevenzione Study proof of the benefits. The GISSI-Prevenzione Study, which looked at more than 11,000 people who had heart attacks in the past, confirmed and built on the DART results. People who took 1 gram of omega-3s every day showed 20% less chance of death overall, 30% fewer deaths from sudden heart disease, 45% fewer sudden cardiac deaths in the first 4 months. These benefits showed up within a few months of starting to take omega-3s, which suggests that they quickly protect the heart and blood vessels. The JELIS Trial, preventing in people at high risk. The Japan EPA Lipid Intervention Study JELIS followed almost 19,000 people with high cholesterol for more than 4 years. Half of the people got EPA supplements along with statin therapy, while the other half only got statins. The EPA group had 19% fewer major coronary events, with the biggest benefits seen in people who already had heart disease and those with high triglycerides. These benefits were not related to lowering cholesterol, which shows that omega-3s work in ways other than changing lipids. Recent meta-analysis, the big picture. Recent meta-analysis that looked at data from dozens of studies with more than 100,000 participants have consistently shown that taking omega-3 supplements lowers 8 to 15% of deaths from heart disease. Risk of heart attack goes up by 13-25%. 30-45% of sudden cardiac deaths. The need for coronary revascularization procedures has gone up by 15-20%. These benefits are seen in people of all ages and health levels, from healthy people to those who already have heart disease. They seem to depend on the dose, with higher doses usually providing more protection. The omega-3 deficiency crisis, why you might not be getting enough. Even though there is a lot of evidence that omega-3s are good for your heart, a lack of them has become a big problem in the developed world. Most cardiovascular organizations recommend that people get 1 to 2 grams of EPA and DHA per day, but the average American only gets about 150 mg of each per day. The problem with the modern diet. Our ancestors got omega-3s from many different foods, including wild game, fish, nuts, seeds, and even the meat and milk from animals that ate grass. Most of these traditional foods are not found in the typical Western diet today. Instead, we get a lot of omega-6 fatty acids from processed foods, vegetable oils, and animal products that come from grain-fed animals. Omega-6s aren't bad on their own, but the amount of omega-6 to omega-3 in our diet has changed a lot since our ancestors ate them. It used to be about 2:1, but now it's as high as 21. The omega-6 and omega-3 fatty acids are fighting for the same enzymes in the inflammatory pathway, which makes this ratio unbalanced. When omega-6s are in charge, they make pro-inflammatory chemicals like arachidonic acid and its metabolites, The drop in fish eating. For decades, people in many Western countries have been eating less fish. Americans eat an average of only 16 pounds of fish a year. That's less than a third of what people in Japan or Iceland eat, where heart disease rates are much lower. There are a number of reasons for this drop. Mercury concerns. Some people in fish species are right to be worried about mercury, but these fears have made a lot of people stay away from fish altogether, which is a shame. Taste preferences. A lot of people just don't like the taste of fish, especially the fatty fish that are highest in omega-3s. Fresh fish is less convenient for busy people because it takes longer to prepare and doesn't last as long as processed foods. Cost. Some people can't afford high-quality fish because it's so expensive. The omega-3 myth about plants. A lot of people think that they can get enough omega-3s from plants like flax seeds, chia seeds, and walnuts. These foods have alpha-linolenic acid ALA, which is a plant-based omega-3. However, humans are not very good at turning ALA into the active forms EPA and DHA. Research shows that less than 5% of the ALA you eat turns into EPA, and less than 1% turns into DHA. This means that you would have to eat a lot of plant-based omega-3s to get any real heart health benefits, which is almost impossible to do with just food. The best omega-3 protocol, what I tell my patients. Based on what I've learned from research and my own clinical experience, this is the omega-3 protocol I tell my patients to follow for the best heart health. Dosing instructions. For primary prevention, people who are healthy and don't have heart disease, 1 to 2 grams of EPA and DHA every day. Focus on EPA, try to get at least 800 milliliters of it. For secondary prevention, people who already have heart disease, 2-4 grams of EPA and DHA every day. Higher EPA ratios may help with inflammation even more. For people at high risk, those with a family history or more than one risk factor, 2 to 3 grams of EPA and DHA every day. For a stronger effect, think about getting prescription-grade omega-3s. Food sources versus supplements. Omega-3s are a special case, though I like it when patients get their nutrients from whole foods when they can. If you want to get 2 grams of EPA and DHA from food, you would need to eat about 6 ounces of fatty fish every day, which is more than most people can or want to eat. The best food sources are 1.8 g of protein per 3.50 Z serving of wild-caught salmon, mackerel 2.6 grams per 3.5 ounces, 1.5 g of sardines per 3.50 Z serving, 1.7 g of herring per 3.50 Z serving, 2.1 g of anchovies per 3.50 Z serving. Things to think about when taking supplements. Look for products that have been tested by a third party. Pick supplements that have more EPA in them. To get rid of the fishy taste, think about using enteric-coated capsules. Put it in the fridge to keep it from oxidizing. When and how well it absorbs. Omega-3s are fat-soluble vitamins, which means that eating them with food that has some fat in it makes them easier to absorb. Usually, I tell patients to take their omega-3 supplements with their biggest meal of the day. If you take higher doses, splitting them up throughout the day can help your body absorb them better and lower the chance of stomach problems. Beyond the heart, the unexpected extra benefits. As a cardiologist, my main job is to keep people's hearts healthy, but omega-3s are good for more than just the heart. My patients are often surprised and happy by these extra effects. Brain health and mental function. About 60% of the brain is fat, and a lot of that fat should be DHA. Getting enough omega-3s helps. Memory and thinking skills. Controlling mood and stopping depression. Lower risk of getting Alzheimer's disease and dementia. Better sleep. Less anxiety and stress response. Many of my patients have said that taking omega-3 supplements has helped their mood and mental clarity, even though their main goal was to improve their heart health, joint health, and swelling. Omega-3s don't just help the heart and blood vessels, they also help other parts of the body. A lot of patients have less pain and stiffness in the joints, better movement and flexibility, less dependence on drugs that reduce inflammation, recovering from exercise and injuries faster, health of the skin and eyes. Omega-3s help keep cell membranes healthy all over the body, which leads to better skin texture and moisture, lowered risk of macular degeneration related to age, better symptoms of dry eyes, faster healing of wounds, support for the immune system. Getting the right amount of omega-3s helps keep your immune system in balance, which lowers too much inflammation and helps your body respond to threats in the right way. Taking care of common worries and myths. Even though there is a lot of evidence that omega-3s are good for you, some myths and worries still exist. Let me talk about the ones I see the most in my work. Won't omega-3s make me bleed more? This is probably the most common worry I hear, especially from people who are on blood-thinning drugs. Omega-3s do have mild blood-thinning effects, but clinical studies have not found that therapeutic doses increase the risk of bleeding. The JELIS Trial, which included almost 19,000 patients, many of whom were taking aspirin or other blood thinners, did not find any more serious bleeding events. But I do keep a closer eye on patients who are taking prescription anticoagulants, and I always talk to their other doctors about it. Don't fish oil supplements have mercury in them? Molecular distillation and other purification methods are used on high-quality fish oil supplements to get rid of almost all of the mercury, PCBs, and other impurities. In fact, these contaminants are often less common in supplements than in the fish they come from. Always pick supplements that show third-party test results for strength and purity. Why can't I just take aspirin? Aspirin does help the heart, but it does so in a different way than omega-3s do. Aspirin stops blood clots from forming, while omega-3s work on the inflammatory processes that cause damage to arteries. A lot of my patients take both aspirin and omega-3s because they work well together, but omega-3s are much safer than aspirin, which can cause stomach bleeding and other problems. Don't omega-3s go bad quickly? Oxidation can happen to omega-3s, which can make them less effective and possibly make harmful byproducts. That's why it's so important to store supplements correctly and buy high-quality ones. Look for supplements that add vitamin E and other antioxidants, come in dark, sealed containers, have production dates that are not too old, are kept in the right place in the fridge when possible. The implementation strategy, putting it into action. It's one thing to know the science, it's another to make long-term changes to your diet. This is how I help my patients in real life. Begin with an assessment. I often check my patient's omega-3 index, which shows how much EPA and DHA are in the membranes of red blood cells before suggesting omega-3 supplements. This gives us a starting point and lets us see how things are going objectively. Levels to aim for. An omega-3 index of 8 to 12% is best for protecting your heart. Most Americans start with levels lower than 4%. It usually takes 3 to 4 months of regular supplementation to reach the right levels. Step-by-step implementation. I suggest taking a gradual approach instead of making big changes to someone's diet all at once. Week 1 to 2, start taking omega-3 supplements and eating 1 serving of fatty fish every week. Week 3-4, eat 2 servings of fatty fish every week. Month 2, add more omega-3 rich foods like walnuts and ground flaxseed. Month 3, adjust the timing and dose of the supplements based on how well you tolerate them and how well they work. Dealing with real-life problems. If your patient doesn't like fish, try salmon or other mild-tasting fish first, or give them fish oil supplements with enteric coating to help with the aftertaste. If you're on a budget, canned sardines and mackerel are a great source of omega-3s for a lot less money than fresh fish. If they meet quality standards, generic fish oil supplements can also work. For people who are always on the go, suggest easy-to-eat foods like smoked salmon, pre-cooked fish portions, or high-quality canned fish. Watching and changing. After taking omega-3 supplements for 3 to 4 months, I usually check the levels again and change the dose if necessary. I also keep an eye on lipid panels. Omega-3s often help lower triglyceride levels, C-reactive protein, and other inflammatory markers. Pressure in the blood. Overall assessment of cardiovascular risk. What will happen next in omega-3 research? The field of omega-3 research is always changing, and there are some exciting things coming up. Nutrition that is right for you. We are starting to realize that differences in genes can change how people process and react to omega-3s. We might be able to give people personalized dosing advice based on genetic testing in the future. New ways to deliver. Researchers are finding new ways to get omega-3s into the body more effectively, such as omega-3s that are bound to phospholipids for better absorption, algae-based foods for vegans and vegetarians, emulsified forms that might lessen stomach problems. More uses. Researchers are currently looking into omega-3s for help with cancer prevention and treatment, managing autoimmune diseases, problems with mental health, pregnancy and the growth of babies, getting older and living longer, what to do next. If you made it this far, you clearly want to improve your heart health by taking omega-3s. Here are the steps I think you should take next. Actions to take right away this week. Check how much you eat now. Keep track of how much fish and omega-3 rich foods you eat for a week. Pick a good supplement. Look into brands that have their products tested by a third party. Start slowly. Take 1 gram of EPA and DHA with meals every day. Add 1 serving of fatty fish. Pick one that you think you'll like. Goals for the next month. Make sure you're consistent. Take your supplements every day and keep track of how well you do. Eat more fish. Start with 1 serving of fatty fish a week and work your way up to 2 or 3. Keep an eye on how you feel. Write down any changes in your mood, energy, or health. Eat less omega-6. Cut back on processed foods and oils from plants. Long-term plan 3 to 6 months. Think about getting tested. Talk to your doctor about omega-3 index testing. Find the best dose for you by changing it based on how you feel and what you need. Make it last. Look for ways that fit with your lifestyle and tastes. Share what you know. Tell your friends and family how important omega-3s are. In conclusion, the fat that could save your life. It's time to accept the one fat that could literally save your life after years of avoiding it. One of the best and most studied ways to improve heart health is to take omega-3 fatty acids, especially EPA and DHA. The evidence is clear these important fats lower inflammation, stabilize plaque in the arteries, improve heart rhythm, and greatly lower the risk of heart attack and sudden cardiac death. But most people still don't get enough of these important nutrients. As a cardiologist, I've seen how heart disease can destroy the lives of patients and their families. I've also seen how much better people can feel when they get the right amount of omega-3s. You can choose, but the science is clear. Don't let another day go by without doing something to keep your heart and arteries safe. Start today, keep going, and give your heart and blood vessels the omega-3s they need to stay healthy. If you found this article helpful, please like it and share it with someone who needs to hear it. Don't forget to subscribe for more health content based on evidence. Your heart and theirs will be grateful.